Hello, listeners. From the RSNA, this is the Radiology Cardiothoracic Imaging Journal podcast. I am your host, Praveen Ranganath, and I am a radiologist from Dallas, Texas. In this podcast, we explore research advances and technical developments in cardiothoracic imaging through conversations with our authors, our editors, and experts in the field. Enjoy! Hi, listeners. Let's jump into an interview that was had with the editor of the journal, Dr. Suhny Abbara, at the most recent RSNA 2023. I'll be reading off some of the interview questions, and we'll listen into Dr. Abbara's response to those questions that were given at the time. What do you enjoy most about being a radiologist?
Radiology is a fantastic field. I feel we're kind of at the center of diagnosing patients. In recent years, radiology has evolved to allow precision medicine. If you think about things like statins, we figured out that statins work if you have atherosclerotic disease, but they don't work if you don't have it. Who knew? Well, we now know, and radiologists are the ones that can give these answers. Radiologists play key roles in hospitals, in tumor boards, and a lot of diagnostic processes. So being a radiologist is very rewarding because we're at the center of identifying, more often than not, exactly what an ailment is and what a treatment could be. We guide minimally invasive therapy. So some of the things radiologists have been able to do is have avoid surgeries in cases where it wasn't needed. If you think of appendicitis, for example, 10% of surgeries were in people without appendicitis, or guide minimally invasive therapies that before needed open surgeries that had much higher risks for morbidity and mortality during those cases. So yeah, it's great to be able to make a difference. And as a radiologist, I think we're in the situation to make a difference for our patients.
How do you feel RSNA has helped provide you resources in your career or for the radiology field in general?
Well, the effect that RSNA had on my personal development, perhaps the career, but my educational development as well, is unrivaled. I say unrivaled because there are many other organizations, many of which I do also like and engage with. But I think it is, without any doubt, the largest and most impactful society for radiologists to come together, to learn, to teach one another, and to evolve our fields, to bounce ideas of one another, form relationships across the nations. The networking that happens here at RSNA, we're at the RSNA meeting right now, is tremendous. You see people from all over the world, like-minded folks. You have a research idea, you might involve your idea just by conversations you have here, and it is made possible by the annual meeting of the RSNA. It checks all the boxes in terms of networking, education, research opportunities, and perhaps not to be ignored is the opportunities for professional development. Many of us, if you are, say, in an academic setting, personal promotion committees look at activities or volunteer services that you provide on platforms like the RSNA, serving on a committee, for example, or publishing papers in some of the journals that RSNA provides are all things that are part of our own personal development. And ultimately, I think there are reasons that promotion committees look at that because they help us move our field forward so that we may treat our patients better in the future.
You were mentioning networking at the annual meeting. I know that's something that every annual meeting attendee says is a very important part of the meeting. Could you speak a bit more about networking and connecting with colleagues?
Yeah, so networking at the annual meeting. Well, we are at the annual meeting right now. And I'll just tell you, I just tried to get a coffee before coming here to speak with you all. And on the way, I ran into a trainee editorial board member, so somebody younger in their career that has a passion for moving the field forward. So we chatted. And there came a world leader of radiology from Europe that I happen to know. So we widened the conversation, the connection, the two of them connected, and then yet another world leader from now Brazil. So we had multiple continents, and we had people from early career to late in the career come together. We solved a lot of problems in the world, but we also made connections that I think will have fruitful outcomes in the future. So yeah, networking is something you cannot avoid here at RSNA, and it really brings people from all levels of the world together. There are cardiologists here, so I'm a cardiothoracic radiologist, so cardiologists are actually here. We have the industry come together. I can't tell you how often industry partners have reached out during RSNA, or that future collaborations have started right here at RSNA, whether it is to purchase a new tool or to engage in research on a future tool that isn't ready for the market yet. So all of these possible future projects would come out of meetings, either planned or ad hoc here at RSNA. The other part I like is I see friends from training from decades back. We all come back here, so you run into people that you know, that you have developed friendships with, and the one place to see them is at the annual meeting here at RSNA.
I know that you are very busy because of your role at RSNA, but what are you most excited about? What types of sessions are you most interested in at the meeting?
There's a nice spread of sessions. There's something here for everybody. And an editor for a journal, I'm looking forward to those sessions where, for example, we have a session where the journal editors from 4 similar journals come together and try to identify where the field is going in the future. This is great. You get to pick people's minds. We will have AI try to do the same thing, and we will compare what AI thinks the future is versus those people. One of the highlights that I enjoy very much are the educational sessions here at RSNA. You have sessions that are well designed by leaders in the field who involve people from, maybe they are senior leaders in the field, and there's always new people entering their subspecialty that give you the highest level of education in your field. And I've been coming to RSNA for a long time, and every single time I can tell I've learned a few new things by attending these sessions. Other things on education that are fabulous are the cases of the day. Very enjoyable. You get to quiz yourself, and it is fun to see the next day when you got something right. Less fun when you got it wrong, but you learned something nevertheless. And I see a lot of people standing in front of those groups talking, actually friends being made. You know, somebody standing next to you, you're both puzzled by the case, sharing some thoughts, and here you are, you made networking, you made a new connection with a like-minded person who was looking at the same case. And another highlight I find are the educational exhibits on the machines. They're top quality educational exhibits that take a topic or a subject, and you can click through them at your own pace. And they're always at minimum enjoyable, but I think nearly always when I click through one of those, I learned something and took something away from it. So those are some of the educational highlights that I enjoy the most here at RSNA.
You were just mentioning the future. What are your thoughts about the future of radiology in general?
Oh, the future of the field of radiology. Yeah. So if you want to know about the future, the best way is to create it or help do your part in creating it, move the field forward. That's just my personal opinion. And boy, the people in the world that do this, they come together here at RSNA. It's wonderful. We have the AI showcase. We have all the vendors here that are creating new tools. And we have all the radiologists in the world that are pushing the limits every day. Yeah, the future is bright because we have a forum where we get together here at RSNA, where we get to exchange with one another. And thinking back 5 years, 10 years, 15 years, today is not how I would have envisioned it back then. So I'm not sure I can predict the future, but I know that there are certain aspects that people are pushing forward that will, at least in the shorter term future, make a difference to our practice. So I see a combination of AI technology now being implemented in clinical care, aiding a radiologist. I see our role morphing a little bit away from just being an interpreter of images, if you look at a diagnostic radiologist, more towards a diagnostician using multiple tools that are not just image-based. So AI currently, a lot of tools take images only and get information out of that. I see We may be going from imager to diagnostician in the future, taking into account additional information, such as from pathology. If you think about pulmonary disease, the pathologist, without knowing where in the lungs the sample was taken, will not be able to give you an answer. But if you take the pathology information and the radiology information and clinical information together, you will be able to make a diagnosis. So I think the future of radiology will have imagers become diagnosticians that use all kinds of tools, including AI, to take information that goes beyond the images to come up with the diagnosis for a patient to allow precision treatment as a result.
And can you speak on RSNA's role in stewarding this future?
The biggest part I think RSNA is doing is providing a platform for all of us that are members, the vendors, industry, and allied health professionals to come together to share our thoughts and ideas and to evolve them. A lot of evolving of ideas and thoughts and research projects happens right here at RSNA. RSNA provides a wonderful platform for people to showcase their new tools, like the industry. There may be a new scanner, there may be a new AI tool, and to find like-minded people that are interested in moving their tools forward. Maybe you're doing it on a research basis because they're not yet cleared for clinical use. Maybe you want to be an early adapter and implement that tool into your practice. So I see RSNA as an enabling platform that brings together people from all aspects of our field to allow us ultimately to move the field forward so that we can do better work for our patients.
All right, really quickly before we get into the journals, what advice would you give to someone who is attending RSNA for the first time?
Well, if I remember my first time, it can be overwhelming because of the many different offerings that are out there. RSNA provides, if you're interested in a certain subspecialty, it provides information about offerings that are within that subspecialty, say cardiothoracic imaging. So those are very useful because you don't have to worry about all the things that are not available. As you plan out your meeting, if you can, get the room numbers down on your Outlook or whatever you use to get organized, because it can be quite a hike to go from one event to the next. Ultimately, meet as many people as you can and enjoy this, and hopefully this will, while it is your first, not be your last. Hopefully there will be many more to come.
Since launching the Radiology Cardiothoracic Imaging Journal, how has it evolved from the beginning?
Having had the privilege of working with the journal from the beginning, it was wonderful. I was allowed to kind of shape some processes in the journal. We have been able to assemble a wonderful group of volunteers, leaders, associate editors, and deputy editors, and an editorial board. And we have the privilege of being able to work with so many RSNA members as reviewers, and that paired with the RSNA staff who's managing the journal was fantastic. So it was wonderful to see all of this come together for one common cause, and that is to fulfill the mission of radiology cardiothoracic imaging. And the mission of the journal is to advance the field, to improve health through publication of cardiac, thoracic, and vascular imaging science and education and innovations. And it was great to see this becoming a reality. I had a little bit doubts this was not necessarily going to succeed, but we came together. And then timing had it that there was a pandemic that happened only a year after the first publication. And we are really fortunate to have so many members that are very proactive in identifying all aspects of this disease and interested in sharing their experience. So we were fortunate enough to get some early publications out. And with respect to the mission, shape the field. For example, we were able to put together a team that wrote an RSNA supported guideline on interpretation of CTs in patients with COVID that helped all of us. We are all struggling on how to do it, helped all of us know one way to do it, to how to read those cases and what it ultimately means. So we were able to respond to the COVID pandemic. We were able to respond to a few other things that were acute. There was EVALI, we thought at some point, was a very important thing, e-cigarette and vaping-associated lung injury. But then the pandemic came and put that into perspective. So then we had a contrast media crisis, and we were able to have some publications addressing ways to overcome issues resulting from the absence of contrast media in your pharmacy. So it was nice to see that the journal not just was addressing our field in general and moving it forward, but in fact addressing what our mission said we should be doing, namely positively impacting healthcare through the publication of articles along those lines. And it took a long time until earlier this year for us to receive our first impact factor. And I'm very pleased to see that the impact factor was 7.0. That is something we're all very proud of, and I know that it is due to the incredible work that all of our editors, editorial board members, all the reviewers, and our authors have been doing. We're very grateful to all the authors for submitting their manuscripts to us.
What sort of feedback have you received about the journal?
Yeah, so I just ran into a person who is a trainee editorial board member who just shared with me his experience in that role. And I was blown away. This was a great experience for that individual. He said that the trainee editorial board leader, Kate Hanneman, is the associate editor who chairs that. Dr. Hanneman does a terrific job. The insight that the trainees are getting on that board are fantastic. The networking through that role was something that he had highlighted. And I was just very pleased because I felt I'm talking to the future of radiology right there. And I've been very happy that we had the opportunity to shape his road, of what will be his career just a little bit.
Could you mention a few offerings from the RSNA that you find very important?
Well, like many of us, I receive a lot of things in the mail or email that often go unread. And I can tell you, I get the newsletters from RSNA, and they don't get unread. I actually enjoy being in the know through what RSNA shares with us, and I'm just happy there's somebody who takes the time to put that together. So that's a great benefit to me. I know what's happening around the world and with other RSNA members and with RSNA in general.
Any final thoughts before we conclude?
I have a passion for radiology. I have a passion for excellence, and I'm doing this not to make a living, but to make a difference. And at RSNA, there are so many like-minded people, and it is very refreshing to see that. And it's very refreshing to see that RSNA is supporting exactly that and is promoting excellence, and that this is a great place where we all can come together and maybe help shape the field. So thank you from me to RSNA and to all my peers that I get to see here at the meeting.